Definitely. So let's go ahead and get started. So, Dr. Springer, you're already on, and I greatly appreciate you joining us. And there's something serious going on, sounds like.
Yeah, I'm happy to be here. Unfortunate for the topic, because this is one that we didn't want to have to deal with in Kentucky for as long as possible, and that's chronic wasting disease. And I did jump the gun a little bit, but I just went with it there at the get-go. So I figured I was just so excited to try to get this message out to folks because it is a big concern. It's a public health issue, and I've got a great guest here to talk about it with soon to be Dr. Newsom, who is the Deer and CWD coordinator for Kentucky Department of Fish and Wildlife Resources. And I'm hoping that she's going to be able to give us a little rundown about the state agency's kind of attack plan that went into effect last year and moving forward. So, Noelle, thanks for joining us.
Yeah.
Absolutely. Are you guys ready for me to share my slides?
Yeah.
All right.
Appreciate you having you on the show today for sure.
Of course. I'm excited to tell you a bit about. First, I'll go into a little bit about chronic wasting disease and what we're doing as a state agency and what the future is going to look like. So chronic wasting disease is a neurological disorder or like a brain disease. It's in the same family as bovine spongiform encephalitis, or what you guys know as mad cow disease, scrapie in sheep, and Creutzfeldt-Jakob disease in humans. The disease agent for chronic wasting disease is the prion, and these prions are just a misfolded protein that all of our bodies make. These prions can be spread directly between deer, so just rubbing, nuzzling, mating, the rut season, and then also through the environment. So they shed these prions through their saliva, their antler velvet, their feces, their urine, their blood, you name it. So these prions, these disease agents that cause chronic wasting disease, they create holes in the brain, and basically the deer just they start wasting away. They lose regular ability to do regular functions such as eat or drink. They lose fear of humans, other predators. And this disease, why it's the biggest threat to North American wildlife conservation is because it's always fatal. There's no vaccine and there's no treatment to date. So as a result of chronic wasting disease, you'll start to see deer looking like this. And these are all confirmed cases of chronic wasting disease in various states throughout the US. So in the Midwest, we have really high population turnover, which means, where in Wisconsin and Illinois, where they've had the disease for over 20 years, we may not be seeing a lot of clinical deer like this. Hunters may say it's an invisible disease. We're just not seeing the sick deer. And that's because population turnover is so high. Deer are having fawns early on. And then they're dying from vehicle collisions, hunting, predators, before they even reach these clinical stages. Regardless of if you're seeing sick deer out on the landscape, you're going to see long-term population declines, which we're already seeing in Wisconsin and Colorado for mule deer and whitetail deer and elk, and lower age structure. So we're not going to see those large adult bucks anymore. The disease will, you'll start to see clinical signs within about 2.5 years of initial infection. And once they start showing clinical signs, they usually don't make it past 6 months. That's if they make it to the clinical stage of this disease. So in Kentucky, we've been doing surveillance for an awfully long time, and we really ramped it up this past year based on Tennessee's detections near our border, which I'll get into with our surveillance zone in the next few slides. But 6 of our 7 bordering states have chronic wasting disease. So we're in a pocket in this Midwest area, Southeast area. And we see additional states popping up with chronic wasting disease more frequently. So we have North Carolina, Louisiana, and of course, Mississippi, all coming up in the last few years. So we have a statewide surveillance system for chronic wasting disease. And you can see just our 2022 kind of quota for how many deer we want tested for chronic wasting disease in each county. And this is based on a multitude of risk factors. So this is the county's distance to an infected state. So you see that our border counties have higher number of deer we need to get sampled, but it also accounts for the number of taxidermists and processors in that state, if there's high deer density there, the number of captive cervid facilities there, and various factors like that. And we work with Cornell in New York. They have a multi-agency project set up that helps states identify surveillance needs each year. And then we'll zoom in on our 5-county surveillance zone, which is nearest the Tennessee detections. But first, a lot of ways that we get our CWD samples is through this freezer program. So throughout the entire state, you'll see this map down here, are locations of our freezers where hunters can drop off their head to get sampled for CWD at any time during the hunting season. They're available from the very first day, so this Saturday. And this map actually isn't updated. We already put out 4 more across the state. So we're really hoping to make this a more popular option, especially as hunters realize that the risk of CWD is here. It's at our doorstep. It's 8 miles from our border. Like I said, Tennessee had 2 recent detections extremely close to our border. In September of last year, they detected it within 7.8 miles of our Callaway County. And then a little later in the season, a little over 16 miles from just south of Graves County. So whenever CWD is detected within 30 miles of our state, we create or we activate our response plan. So this created a 5-county chronic wasting disease surveillance zone where we heighten surveillances and put in regulations to help prevent the introduction, slow the introduction, and slow the spread of the disease within our state once it gets here. So these 5 counties are Callaway, Marshall, Graves, Hickman, and Fulton. In these 5 counties, there's no baiting or feeding of wildlife. There's no taking out full carcasses or high-risk parts such as the spine or intact skulls out of the zone. You can only take out deboned meat or finished taxidermist products, clean skull plates or antlers. Then we also will have mandatory check stations during weekends of modern gun season. So the first weekend is going to be Saturday, Sunday, Monday. The second weekend, Saturday, Sunday, Monday, and then that third weekend will be Saturday and Sunday. And that's where we will have 14 check stations throughout those 5 counties where you have to bring in your deer to get checked and tested for chronic wasting disease. It was a huge success last year. We had 17 check stations, so we're just doing a few less. But we had hunters come, you know, even when they didn't harvest a second deer, they would just come to talk. They said it reminded them of the good old days, how they used to bring their deer in person to get checked in. They would bring us food on holidays. We worked on Thanksgiving and multiple hunters and their families came back to bring us food. So it was a great experience given the terrible circumstance. So last year, like I said, we heightened our surveillance. We tested over 7,500 deer. Normally it's a little over 2,000. And we tested 55 elk in our Eastern Kentucky area. CWD was not detected in any of those deer, which is great. Over half of those, so over 4,300 of those deer came from our 5-county Western Kentucky CWD surveillance zone, which is really awesome. And again, chronic wasting disease was not detected, which is a little mind-boggling, knowing how quickly deer move and how far they can move, and knowing it's that close from our border. So to the top right is just a general idea. These are mostly roadkill or sick clinical deer that we tested for CWD, where we have actual points from. And you could see just how many deer came out of that 5-county area in the very western part of our state. And then at the bottom right, we were taking 1-mile grid locations from the hunters that came in and checked their mandatory deer to get an idea of just how much area were we covering by testing for chronic wasting disease with these hunter harvested deer. And you could see that we covered a lot of area with the darker colors, meaning more deer got taken out of that 1 mile square. So the circles indicate a 10-mile radius from that Tennessee detection that was nearest our border, and then 30-mile radius, which indicated our management and our surveillance zones. And we far surpassed our sampling goals for those areas and feel pretty confident that if the disease is in our state, it's at extremely low levels. And I would really like to take this opportunity to answer any questions. I know there's a lot of misinformation about chronic wasting disease, so I'd love to kind of do some myth busting any chance I get. So yeah, that's what I have, and thank you so much.
Wonderful. Thank you so very much for joining us today. And one thing I'm sure people are wanting to know is like, well, if I accidentally or eat a deer with this, is it going to hurt me? Right.
Matt, do you mind if I take it?
Yeah, go for it.
So they there's actually one study in mind where a hunting group in New York, I think this was in the very early 2000s, had kind of a banquet situation, and they all found out a couple weeks later that they ate infected venison. So they've been kind of doing a long-term study, checking in with these hunters. And so far, they're all okay. I mean, there's never been transmission to humans of chronic wasting disease. However, we do see in some studies that macaques and other primates have gotten CWD from eating infected meat. So, we don't want, CDC recommends that hunters do not eat CWD positive meat. So we say the exact same thing. If there's ever a jump between the barrier, the species barrier, mutations may occur. We don't want that to be with our Kentucky hunters. We don't want them to be the first one to get chronic wasting disease.
Yeah, a lot of the concern is based on the issues that happened in the UK with bovine, with mad cow. That one, there were folks that did develop issues. So because these are so closely related, and we have a version of the problem in humans, there's a real safety component there of just, we don't want to screw with it enough to find out if it can or cannot. Unfortunately, with its prevalence in the West for upwards of 6 decades now, there are folks over there that have been consuming positive animals for probably quite a while. And the real cutting edge experts in that field of study are, we're going to find out, is kind of how they put it, because there are enough folks out there that are consuming meat, regardless of whether they know it's positive or not. And over time, we'll find out. And hopefully it remains that it doesn't ever jump.
But, Matt, that brings up a question that I've had. Noel, you'd mentioned how many you all have tested for this. I was just curious, what percentage of all deer harvested is that? Or do you have a guesstimate, I guess? I was just trying to get a sense of how many more are out there or annually harvested, I guess.
It's an extremely low testing rate, probably less than 10%.
Oh, wow. So we're harvesting a lot of deer in Kentucky.
Right. It was only mandatory testing in that 5-county area during our early and late muzzleloaders and our modern gun. So that's only a small portion of the state and only some of the season. So we're really hoping that that'll increase, and a lot of people will get their deer voluntarily tested.
Yeah. There was a couple of questions that snuck in, and one was ask you to kind of, what was the I guess causal agent? They had missed that at the beginning. What's causing this to happen? And then there was a question about kind of, do you have an update on how prevalent it is in Tennessee as well?
Yeah, it's caused by a misfolded protein called a prion. So it's your body makes these proteins, and it just so happens that when one converts to this misshapen version, it causes this neurologic disease. And so for deer, it was caused by a bunch of deer being in an area that held sheep with scrapie. So those sheep got taken out of that pen, and they thought everything was fine. They put some deer in later on, and they all ended up getting the disease, and then it got into the wild deer. And that was out west.
Was that like patient zero out there for chronic wasting disease?
Yeah,
Wow.
absolutely.
Wow.
And as for Tennessee, their website is a great resource. They have extremely high prevalences in some areas of their southwest area of the state, and it's popping up in other counties. So definitely take a look at their website and stay up to date with that, because it continues to spread.
Okay. Well, hopefully we can keep it out of Kentucky as
Yeah.
long as we can.
I'll get that website and throw it in the chat there after we're done here.
That'd
So
be great. All right. Well, thank you both for joining
Yes,
us. It
indeed.
doesn't look like there's any more questions, but we greatly appreciate you giving us an update on that.
Yeah.
And if something happens and we need to get more information, please feel free to reach out to us and we'll get it out to folks.
Thanks so
thank
much.
you.
Yeah. Thanks, Dr. Springer. Noel, thanks for coming on. We'll have you back again.